surface of the femur, so the patella does not articulate directly with the tibia. Okay, so I want you to associate it with the femur. And it has an anterior side, which, don't worry too much about it, and the posterior side has these articular surfaces, again, articulating with the distal aspect of the femur. The tibia itself, the main features I'd like you to know about this, it's the main weight-bearing bone of the leg. It's the bone that's also called, in the more common vernacular, the shin bone. It articulates with the femoral condyles superiorly. So again, we have these condyles, which are these little circular areas. And so we have these tibial condyles somewhere here. The medial condyle here and lateral condyle. And really, the articulation technically occurs at this plateaus. Don't worry so much about that. Just want you to note the condyles really of the tibia and the femur kind of articulate with each other superiorly relative to the tibia. It articulates with the talus inferiorly, and when we look at the leg bone, we'll see how it kind of rests on there. The fibula laterally, so this is the fibula. Remember, this one does not bear any weight in a significant amount, and it does so at the proximal and distal ends. This lateral malleolus actually, and the medial malleolus is a couple of areas that I'd like you guys to keep in mind when we take a look at some of the locations of veins and in the lower leg. Again, I'd also like you to know that the medial malleolus arises from the tibia, and the lateral one arises from the fibula. The nutrient foramen, which there was also actually one by the linea aspera in the femur, is basically this site where you can kind of get blood vessels which run through a nutrient canal leading to a medullary cavity in these long bones of the body. And we know these cavities are the sites of blood cell production initially. So looking at some tibial fractures, there's a term that you guys might have heard before. It's something called the compound fracture. And really, when you have a compound fracture at the site of the tibia, the shaft, you're kind of really talking about one that not only breaks the bones, it kind of goes through some muscle sometimes, and even and then especially the skin. And so you kind of really have an area where you perforate the blood vessels and out through the skin. I don't know why, but I feel like there should be some sort of video game special effects sound when I saw this. So this is a compound fracture. The diagonal fracture kind of does not go all the way through the skin. So you examine a young patient in the emergency room who's complaining of ankle pain.